Good evening, everyone. My name is Jeff Molter, CRNA, with the Middle Tennessee School of Anesthesia. Thank you all for getting together tonight. I pre-recorded this just in case I had techno issues here. I'm actually on vacation in Texas and staying in a hotel here, and I'm sure I'm going to have enough bandwidth to do this live tonight, so I'm going to record it just in case. But anyhow, I want to talk about the use of botulinum toxin type A for midline incisional hernias. I'd like to thank General Surgeon Terry Rager, who I work with at Finley Surgery Center. He's been doing this for a couple months now, and him and I have had several discussions. Now, he's been doing this in his office. He's been injecting the abdominal muscles in his office and then bringing his patients to the hospital, where unfortunately I do not work. I actually work at the Finley Surgery Center. But just in speaking with him, this seemed like a really neat topic and something that I think a lot of you are going to be seeing in the future if you're not currently seeing it now. And we kind of had a discussion about how the surgeons are doing these injections, but it makes perfect sense for people like ourselves who are skilled in using ultrasound and guiding needles into muscles, fascial planes, around nerve bundles, that we too could also perform this. I also want to say that I know a CRNA in Northwest Ohio. He works at a small rural hospital, and he had a general surgeon approach him a couple months ago, and he asked him to perform this procedure on one of his patients so that he could reduce the patient's ventral hernia several weeks after the injection. And this CRNA did do that and had great results. I do want you to know that this is an off-label use for Botox. Hopefully, as evidence builds, it will become more acceptable. So what is Botox? Botox is actually the brand name for botulinum toxin type A, or BTA, which is a neuroendotoxin. And basically what it does is it blocks the release of acetylcholine. And by blocking the release of acetylcholine, it prevents muscle contraction. Now just know that there are other different types of botulinum toxin type A's. I think there's 2 or 3 different brands, but here we'll be talking about the brand of Botox. It was discovered in the late 1800s, and as many of us already know, it's used in facial plastics and things like that to reduce wrinkle lines and things like that. So who would have ever thought of using it on the abdominal wall to help facilitate ventral hernia surgeries? So what are the effects on the abdominal wall? Well, when we use Botox on the abdominal muscles, specifically the transversus abdominis, the internal oblique, and the external oblique muscles, we know that it paralyzes the muscles. It takes effect in 2 to 3 days, and we see the maximum effect in 2 weeks, and there's more paralysis up to 4 weeks, and this all declines around 3 months. And again, why use it on the abdominal wall? Well, we know that when we accomplish these things with the muscles, it will increase the intra-abdominal volume. It's also going to lengthen the lateral abdominal wall 2.5 to 4 centimeters per side. I know that doesn't seem like a lot, but when you have a patient with a large ventral hernia that needs to be repaired and the muscles are really tight, that 2.5 to 4 centimeters per side will really go a long way in helping to close the hernia. The effects of the Botox on the abdominal muscles is that it also reduces the abdominal muscle thickness by about 1 centimeter because they stretch and they lengthen out. And the overall effect is that this will decrease the size of the hernia defect. I'm going to show you a couple images here of CAT scans that we're taking of the intra-abdominal cavity here. I want you to look at this one on the left here first. So this is pre-Botox, and we could see that the length of the abdominal muscles here is about 8 centimeters on the left and about 7.8 centimeters on the right. And the image below was taken 4 weeks after Botox was injected into the 3 abdominal muscles. We could see on the left we have an increase of length of about 2 centimeters, and the same on the right, a little bit increased length of a little bit over 2 centimeters. So this increased lengthening of the abdominal muscles essentially gives us more intra-abdominal volume, and it would make this ventral hernia easier to repair. On the right side here, what we're measuring is the thickness of the three abdominal muscles. Again, 3.87 centimeters on the left, 3.82 centimeters on the right. This is the total thickness of the transversus abdominis, internal oblique, and external oblique muscles. And 4 weeks after injecting Botox into those three muscles, notice how the muscles lengthened and they thinned out about 1.5 centimeters or so down here. So 2.3 centimeter thickness and 2.7 centimeter thickness on the right hand side. So how do we go about accomplishing this? What is the technique? So first of all, I admit I have not done this. I have just heard the surgeon I work with describe how he does it in the office, and I have seen a couple videos of surgeons describing it, and most of them are performing this in the radiology suite with some IV sedation and a little bit of local anesthetic for the skin. It's essentially just like you're doing a tap block, right? So however you typically do your tap blocks, I know that we usually give a little bit of IV sedation. We use a sterile technique, and what we're going to be doing is using ultrasound guidance, and we're going to use a tap needle, 80 to 110 millimeters, 21 or 22 gauge. Does not have to be a stimulating needle, and preferably an echogenic needle. Scott and I do like the needles from Payunk. We feel that they light up very nicely. Now, as far as the Botox, we're going to use about 150 units of Botox diluted in 100 milliliters of normal saline per side. So our total dose of Botox is going to be about 300 units. Now, apparently the maximum dose of Botox is 400 units in a 3-month period. What we're going to do is we're going to inject in 3 different locations on the lateral abdominal wall, and in each location we're going to inject all 3 muscles. So we're going to put a little bit of the Botox mixture in each muscle in the 3 different locations. So if you think about that, you're going to be using 150 units of Botox and 100 milliliters per side. So you have 100 milliliters to divide between those 3 sites. So you have about 33 milliliters per injection site. And in each site, you have to go to each layer of the abdominal wall, which is 3 more layers. So you're going to be using about 10 to 11 cc's per muscle, and your total volume then will add up to about 100 milliliters. Now, there's a little bit of, there was a little bit of a controversy. I read an article about, do we really want to inject in the transversus abdominis muscle? The transversus abdominis muscle is a core muscle that helps control our spine, helps provide stability to our torso, allows us to cough and deep breathe. And if we weaken the transversus abdominis muscle, some people feel that we could cause some issues for a few months with patients being unable to cough heavily, or to have issues controlling their spine, and they could end up having back pain. There was a study where they compared 23 patients in one group where they injected all 3 muscle layers, and then the other 23 patients they injected just into the internal and external oblique muscles. And what they found out that there was no statistical differences in the outcomes of the patients as far as side effects and things like that. Now, one of the things you might ask about, what is the cost? Well, Botox is about $580 for 100 units, and here we're going to be using 3 units for, so it's about $1,740 to perform these injections on the patient. Now, as far as technique, these images are from BlockBuddy, and as I said before, we're basically going to pick 3 injection sites on the lateral abdominal wall, and in each site we're going to inject into each abdominal muscle. So we have 3 injection sites, and in each site we're going to put Botox within each of the 3 muscles. So this first site is basically in the mid-axillary line between the iliac crest is down here, and the subcostal margin where the lower ribs are is here. So we're going to go right in that midpoint here, right in the mid-axillary line. We're going to do our injection into each of the three muscles. Then we're going to take our needle out. We're going to go a little bit anterior and superior for our next set of injections into the three muscles. Now we're just going to go a little bit inferior, just anterior to the mid-axillary line, and do our last set of injections here. And again, it's going to be a bilateral procedure. And we could see on the right side of the screen is these are the layers of the abdominal wall that we could see on ultrasound. Obviously, the transversus abdominis is the deepest muscle, followed by the internal oblique and then the external oblique. These are the different articles that I used, and I will gladly put them on Microsoft Teams so you can access them and check them out. But these articles do describe the technique that I talked about. The very first article from 2009, they actually used more than 3 different injection sites, but they were not using ultrasound. They were using an EMG stimulator connected to a needle, and they were looking for muscle twitches before they injected. Also, the right hand part of the screen, I cannot pronounce this physician's name, Dr. Tyrion, but she is a surgeon in Hollywood, and she actually did a nice YouTube video describing how she does this. So as far as the future, very interesting. There were some studies that were done that showed that Botox does have some type of effect on pain modulation, and it also does factor into the inflammation process. So the question would be, can Botox be somehow used as an adjunct for postoperative pain relief? I know that Dr. Rager, the general surgeon who I work with, said that he did see some studies that showed that patients' pain scores were lower after they had these Botox injections of their abdominal wall. So again, this is an off-label use of Botox, but I think it's something definitely worth having conversations about with your general surgeons, particularly the ones that do the very large ventral hernia repairs. My name is Jeff Moulter. If you think of any questions or comments, feel free to email me, jeff@myblockbuddy.com. Thank you.